President of the Saint Lucia Medical and Dental Association, Dr. Merle Clarke, is cautioning against the blame game as the number of COVID-19 cases rise once again in Saint Lucia. The thrust and parry of the battle against the pandemic has been punctuated by wave after wave with intermittent lulls in infections. With the dreaded Delta variant on the horizon, Dr. Clarke is exhorting Saint Lucians to take the vaccine.
Saint Lucia, the reality is there is a sense of frustration among the medical community, among our colleague healthcare workers. Not only did this happen, but the blame game is not what we're going to do. It is not the time for this. The reality is we have a problem on our hands and we have to do something about it. We know what the tried and tested measures are. The best tool we have in our arsenal are vaccines. We know that there's still a whole lot of hesitation to taking the vaccines, concerns about the potential long-term side effects. But if you're standing in a fire, the reality is you have to find a way to not get burnt as you learn how to put out the fire. And I think I saw this analogy used on the weekend, and it was very, very apt. You don't get burnt in the fire because you're thinking of the long-term consequences of fire extinguishers. Those vaccines have been tested, they've gone through trials, very rigorous trials, and they work.
The Slmda president pushes back at the Monday morning quarterbacks and internet experts who sow the seeds of vaccine hesitancy, advising that St. Lucians stick to the exacting evidentiary process of science. With only 32,000 St. Lucians fully vaccinated, many citizens will be sitting ducks for the strain which has reportedly ravaged populations in other countries.
We know that we have to continue the consultation, but we urge St. Lucians. There are way too many Facebook and Google experts. Even as medical practitioners, we find it difficult to decipher all the information that is available online. The reality is anybody could put anything online, but the scientific rigor that is necessary, those vaccines have gone through it. So we urge you to get vaccinated. The Delta variant has been definitively identified in several of our neighboring islands. To the north, to the south, it really is the dominant variant in so many countries around the world. And I think we'd be naive to think that it's not here. It just has not been detected. Samples are being sent to CAFA, and thus far it has not been detected. But we are seeing a huge spike in the number of cases of COVID-19. We are going to see hospitalizations. The unfortunate reality is that we have a very low vaccination rate. And what we know about vaccines for sure is that, of course, they don't prevent COVID-19 100%, but what they do prevent is hospitalization, serious illness, and death.
Dr. Clarke explains that the sense of consternation is well placed and the country needs to gird for stringent restrictions, including the suspension of masquerade events.
We believe that at this point, all masquerade events have to be cancelled, that permission cannot or should not be given to host any sort of event in any number, quite frankly. That we have to curb this, lest it becomes too much for us to handle and our healthcare system becomes overwhelmed. From the very beginning, that has been the aim, to prevent our healthcare system from becoming overwhelmed. We know it's fragile. St. Lucia, we can do this, so let's do it.
The Slmda president voiced support for Dr. Tanya Destang-Bobre's impassioned plea for action to ensure the healthcare system is not overrun with cases. Dr. Clarke, who condemned the recent attack on St. Vincent and the Grenadines Prime Minister Dr. Ralph Gonsalves, weighed in on the anti-vax protests amid talk of vaccine mandates.
Do we as a medical and dental association support mandatory vaccination? It is a tough question because we like citizens to always have the freedom to choose. That's a reality. We live in a democracy and we would like citizens to have the freedom to choose. That being said, are we also infringing on the rights and the freedoms of those who chose to do the responsible thing and get vaccinated? Because when hospitals become overwhelmed, those vaccinated people who may have another pathology would be affected. The reality is, to prevent our healthcare system from being run over, our hospitals from being full, our healthcare workers from being burnt out, we need to get people vaccinated. And one way or the other, we have to find some way to do it effectively. There's a lot of misinformation, there are lots of theories out there, and we need to do a lot more debunking. But St. Lucia, we need to do this in a responsible way.
The Slmda welcomes feedback on how best to effectively communicate to the populace on the importance of COVID-19 vaccines. Dr. Clarke made it clear that vaccines are not a cure-all, but an indispensable tool to reduce the likelihood of an avalanche in severe cases, which the healthcare system simply does not have the capacity to respond all at once. Joachim Duplessis, HTS News Force.